Okay, welcome to EnviroVibes podcast, a podcast where the vibes are high and the environmental impact is low. In today's episode, we're diving into the world of healthcare and supply chain. I'm your host, Samantha. We're going to be also exploring its definition, the importance of engaging with diverse companies and vendors in healthcare, and having an in-depth conversation with one of our partners in the industry. So we have a very interesting guest joining us today, former Marine Corps and Navy veteran, bachelor's degree from U.S. Naval Academy and master's degree from USC, certified in supply and logistics management by the U.S. Marine Corps, about 15 years at PepsiCo with supply chain and operations management, over 30 years of experience in supply chain sales, operations, manufacturing, and distribution. As the System VP of Enterprise Supply Chain at PIH Health, please welcome to the EnviroVibes podcast, Chico Manning. Welcome, Chico. Thank you for joining us.
Thank you for having me.
And we have Gus as well, our president of Quality Environmental.
It's an honor to have you here, Chico. Thank you. And thank you for your service, too. I have a great respect for our military forces.
Yeah, and I appreciate that. It was my honor, my privilege, and I'm glad to be here. I feel like a VIP.
Oh, you are our VIP, always.
You
been.
are a VIP. After looking at all the things that you've done, I'm like, whoa, this guy is like, I don't know, it just looked like, whoa, this is a lot.
All you're missing is if you fly to the moon, you know, airship.
I appreciate it. I mean, it happened in the blink of an eye, 30 years, progressive supply chain experience. I was lucky enough in the Marine Corps. That was my job, supply logistics.
Yeah.
And then I was able to kind of take that to PepsiCo, 15 years at PepsiCo. Healthcare the last 8 years. And then so when I look back,
Amazing.
And then as I heard Samantha read it and say, gosh, 30 years, it happens in the blink of an eye, but man, it's a journey. You get to meet great people, interact, and I wouldn't change a thing, I don't think, the last 30 years.
Nice. That's
yeah,
amazing.
So my question when I was looking up all this stuff was like, who is Chico? Like, there's like all these like accolades and stuff, but like what got you or what motivated you to do all these things that you've done?
Similar to Gus, I'm a child of an immigrant, right? And my mother was a Korean national. My father was drafted African American in the 1960s to the Vietnam War. All the odds said I shouldn't be here talking to you, right? Because he was a Vietnam War veteran. She was a Korean national. They got together.
Wow.
I came along. He did the right thing. He stayed. He married her, brought her back to the States. And that's where all the opportunities, as Gus and I were talking about earlier, right? Just all the opportunities we have in this country, and to be,
I know.
When you come from an immigrant family, and what drives me is I want to make sure, whether it's my story or if I can highlight a friend's story, especially from humble beginnings, right?
Yeah.
And so when I hear about the accolades, even to me, there wasn't like a goal list. Hey, I want to be a vice president or I want to serve here. I just wanted to make my mother proud, right? And my mother told me, she goes, I'll never forget it. She said, Korean mothers have one goal in life, to leave their children in a better state than they grew up in. That's been my mantra. So how does that carry over to my time in healthcare?
Yeah.
I have, we meet companies and great individuals like you guys have at QE, and you represent the community, and when we interact and we have shared experiences. Can I help other individuals through business partnerships, through networking, to basically make it a better life for the folks that work for us, for our parents if they're still around, for our children. And if at the end of the day, we can look in the mirror and says, hey, I did right by everybody I interacted with. My mother, she passed 20 years ago from lung cancer, but I know if she was here today,
she'd be so proud.
She'd be proud of that. That hey, not only am I hopefully providing a better life for our children, her grandchildren, the community in general, and that's what I like about healthcare. What I like about your organization. It starts with community, right?
Yes.
Yeah.
Everybody you employ, every patient that comes into our health system, and so since I have some influence, how do I want to impart that in what I believe in? Well, I'm going to give diverse businesses a chance, right? I'm going to try to educate those businesses that might not be aware of how do you even get to the table, right?
Right.
Yeah.
You know, Gus, I know in your story, there's probably a time where you're like, how do I even get to talk to someone to get to that contract? For a while, you're working for other people who are getting the contract, right? And they're like, and you're doing the work. Well, I see that. And so why don't I just go to the folks that are doing the work anyway? A lot of those organizations are diverse businesses.
Yeah.
And so as I support California's initiative on increasing diverse spend in healthcare, our partnership that we have with Quality Environmental in our organization, and personally, it's a win-win for me. So that's
I think it hits home for you, and I think that's why you're so connected. So I was, curious. I wanted to see what the connection was, and that's pretty cool.
And because day one we walk in the job and talking with I believe first we met with Jose. And I start seeing the diversity in the community and the people and the team that you employ, and that's something that really attract me as a small business owner and a family-owned business, that the way you guys give the time and the opportunity to companies like us, that's what attract me to work for your company, and for you giving us the opportunity in this very, very large project that, it gives a message out there to the community that, being a business owner, for a small business, we start from scratch. So we know all the ins and outs, and that makes us unique and different, and to stand out of the crowd, not community, but stand out of the crowd industry per se, because it's not all about the money. Money, we all make and we have to bring revenues, but doing the right thing, especially working for the healthcare facilities. You're working with patients, around patients that it could be your parent, it could be your uncle, it can be your kid, your son, or a baby.
It's very true.
To be able to go there and give our 100% and add value to our services for clients like you, and I will say any other clients that we work for, we always add that value, the experience and the skills combined with all my team to be able to, give the outstanding services. But I'm very curious. So when we walk in this project, what do attract? Probably, you guys do research, but to give the opportunity to our company, what was the I would say the key point?
Yeah, no, that's a great question. So I will tell you, we had no idea who to call, right? This was the largest project our organization had undertaken in this area. So we basically started asking around the hospitals, anybody know anybody that can even do a project like this? So as you and I have discussed, right, an associate of yours from the past, Richard, sent me an email and says, hey, Chico, I know you're looking for someone for this project. Back at another organization, I worked with him in this company. They do solid work. Up to you, you decide. So, and at that time, we had gotten more the mainstream, automatic kind of vendor. Hey, we do this job. And we had already walked with them. And when they walked fast.
I hear that.
They didn't ask a lot of questions. When they walked, they got to the point, and all of a sudden we had a big, long document, which we're used to seeing, and said, for everything we just walked, that's your number. Now, your team came in, and we walked. We didn't walk fast.
Nope.
You wanted to see, touch, and understand the project. You asked a lot of questions. So when my team, Jose Sanchez, came back, and I had walked on the first one, I couldn't walk on the second one.
Yes.
So Jose walked. Jose conveyed that to us, and even the numbers, and I'll be honest, the numbers were close. Yeah. It came down to, we said, okay, and I remember going around the room and I says, what do you think? And Jose goes, you know what? The fact that it just felt like they cared more when they walked. They asked the questions. Yeah. And then I looked at it and I said, okay, I think so, even though the other company was like, hey, here's who we are, here's who we've done. And then I go, you know what? We also have this vendor diverse initiative. We're not, if that's the deciding vote, Jose, I trust you. We're going to go with that vote. And also, just by you being a diverse owner, I said, you know what? That's just going to be bonus. But we chose you on the walk, the interaction with the walk, and the fact that you were a diverse vendor at the point. At the end, it was really kind of a perfect ending. But that was really the sell point for us. So I know, pretty incredible. I know that's your mantra, that's your approach. So I have to tell you, don't change it, because I know you're not. But I'm telling you, if the organization really cares about the project and you're coming on site, that intimacy and that transparency during that walk, that's what sold us.
No, thank you.
And then I always follow with this. So we didn't know, right?
Yep.
And then the work starts, and the people come in.
Correct.
And your team came in. We came up with a plan. Man, by week 2, we knew we made the right decision. I remember my internal team going, we almost made the wrong decision, because the way you executed the shifts, the way you communicated with us, the quality of the output of the process was way above our expectations. We knew very early in the project, man, how did we almost not pick them? So I think that's what people will see with your organization. On the surface, they're going to know the story.
Correct.
They're going to hear the success.
Right.
But when they see the work, trust me,
they're
going to be like, forget all the other stuff.
Yeah.
We should have picked them first. That's the selling once you're in there. Because by week 2, we're like, we made the best decision in the world.
Thank you.
But we were this close to making the wrong decision. So a little luck, a little timing, but it worked out perfectly, and that's why we're proud.
And how long did the project take?
So the project, so it's a great question. We were handed the project, and they said, you got 4 months. And most people in the industry would say, no way.
Yeah.
You're going to either have to cut corners, or you're going to have to bring in a whole lot of people, and really overspend, because it's 24-hour days, 7 days a week. You guys came in, Quality Environmental came in and says, here's what's needed to do the project by this date, safely and adequately. And then there was like a mid-project, hey, you never said we're not going to make it. But we could tell as you're going, you actually over-delivered. You finished, I think, 2 or 3 weeks ahead of schedule.
Yes.
Wow.
Not by rushing, not by cutting corners, not by putting extra labor, not because there's another job waiting, just the way you executed the work.
Yeah.
So that we not only got the project and the outcomes that we desired, we also got it well before schedule. And I always tell people, it was the best Father's Day gift for a lot of us, because all we were focused on your side and our side, was this project, and we were done by Father's Day.
Wow.
So I know that wasn't the intent.
You know
That's
what?
crazy.
We had until July 4th that year. We were done by Father's Day, so my team remembers. Man, that was a gift.
That was a good Father's Day.
Yeah, it was a great Father's Day, but it really manifested from how your team approached the work.
Thank you.
Like the complexity of the work, when you think of a building that was been around for 30, 40 years, and the amount of material, paperwork, and trash, and for the stuff that we said keep, you cataloged it. You cataloged it accurately. You took care of the environment. It wasn't just a go in and empty. That would have been easy.
A lot of documents.
Go in, document, organization.
Historical documents.
Historical documents. Some of it was... So now when we moved it all over to our legacy building at our main campus, it's still, I can still see the QE organization on the pallets.
Oh, that's crazy.
So as we go through that and we reduce that inventory, it's easy to go through it even 3 years later, because the organization on the front end. You really can't, that kind of stuff you can't put in a document, you can't even predict.
Correct.
It just came out of the way you approach it.
Thank you. And as I remember, I mean, we walked the job, I will say every time, 3 times, about 3 or 4 hours. I think that was the initial.
That was just initial.
Initial. That was like 4 hours each visit.
Yes.
And I was challenged. I mean, not challenged, but question, Jose. I want to. I have tons of questions, but this is the most important things, so I can come up with the most cost-effective solution in a way that we can coordinate our team and finish in time. Because even the 4 months was a tough. I will say not impossible. But a tough schedule to meet.
I mean, I'll tell you, your team, and you see it here, your confidence that you show, and no job too small, no job too big. We're going to push it the right way. Your team showed it, even when you weren't there, right? And it was your foreman or your supervisor or your manager or even the third guy from the bottom. You could see that throughout the whole team. And that says something. It says something about your culture you have in this organization, the work ethic, who you're hiring, who you're keeping, right? It's a very familial feel. I see it every time I come here. I meet the various members of your organization. That doesn't happen in most organizations.
No.
You can't just say, I'm going to pay you this and get loyalty like that.
Correct.
Get buy-in. And it all flows to this common theme I'm trying to paint, the work, right?
Yes.
You see it. It doesn't surprise me now that you can do big projects on time, early, exceed expectations. And here's the big point. Very dangerous environment.
Yes, it is.
I don't even think you had a splinter.
No, we have zero accidents.
We are required on projects like this, right, to every day list who was in the building and if any significant injuries.
Injuries,
Not a single significant injury.
Zero accidents and injuries.
That's crazy.
And you can see this environment for those folks that have know what we're talking about. It's not like here. It's dusty and you got to wear PPE.
And it was during the summer. I mean,
I'm
sure it was hot.
April till July, till June.
I'm sure it was hot.
Heavy material.
Yeah.
Elevators that didn't
we have a challenge with the elevators. We were unloading stuff through the stairs. Yeah, stairway.
Oh my
Sometimes
gosh.
stairs to get to a working elevator.
2 or 3 floors, or maybe 5.
Yeah,
I don't think I could do that. I think.
Well, we can do it. We in quality can do it. You know?
I think I've been.
The bigger the challenge.
You have the right team that can boots on the ground, and then you have the expanded team like this. Who would have guessed, right? We'd be sitting on this couch today,
definitely
3-4 years later, talking about that experience, and I'm happy that we went through it.
Because and that's the message we want to give, to the potential that we, the community, and a small business, family-owned business have. We had the potential to do small, medium, and large projects, and we had the knowledge and experience. I've been in the industry for 35 years. I started when I was 17 years old.
I remember
very young.
That's crazy.
Out of my garage in 2005. We started QE. Almost, it's going to be 19, 20 years.
Amazing.
And hiring, like you said, hiring the right people. I will say we had the best of the best in the industry. Including Samantha and Adonis and my vice president Liz. It's a great support for the company. And then the rest. I have a lot of respect from the people who's cleaning outside to the estimators and the people who's running the financials. It's important. My biggest investments, I will say, is our business culture. Our business culture is the nucleus, is the matrix of the company. Everything starts from here with the people. We the people. It's not about me. It's about we, the team. Quality environmental.
Yeah, and I'm glad, and that's who I want to do business with, right? So when you have a diverse, especially in healthcare, you have a diverse vendor initiatives, right? Yes, you want to invite diverse vendors, but you also want to invite the ones, hey, they remember where they came from, right?
Yes.
They're investing back into the community.
Correct.
I see that. Our health system prides ourselves on patients first, but it's really community first, right?
It is.
Yeah.
The folks that are coming through our ED look like the folks that are working for you, right? So we want them to be healthier. We want them to be more economically stable. If they can work for a company like yours in our local community, and they can provide better for their families, they're going to be healthier.
Yes.
They're going to be safer, which means less catastrophic incidents at the health system. And hey, now the community's getting stronger. Now you have more breadwinners, and you have now their children are like, hey, dad and mom, I'm in a better spot.
Yeah.
And then I tell my kids all the time, maybe 3 or 4 generations from now, someone will say, man, where did the Mannings come from?
Yeah.
It all started, mother didn't speak a word of English.
That's true.
2nd grade education in Korea, met a Vietnam veteran, African American, in a country that didn't appreciate him or them at the time, came back. And
that's crazy.
They would not have written on a piece of paper. Both their sons, college graduates, maybe get a good job. All they wanted was a better life than what they had.
We're all human beings, and the human touch is so important that people ignore in our corporate world,
Right,
something that I acknowledge and admire from you, Chico, and a great company that you work for is that, giving that opportunity and believe, because I remember with Adonis when we not signed the contract yet, you said, guys, I have this meeting with my staff. Let's meet so they can hear from you. You can talk to them because they have a lot of questions. There were tons of questions, but I said, no, I'm ready. This is what I do. This is my passion. Abatement, cleanup, demo, especially healthcare facilities. Let's do it.
Yeah. How many people were there?
I show up with the Donis there in Godoy.
We had all the internal stakeholders. So we had the logistics people, the admin people, the safety people. And then Gus and Adonis were there, QE, and some other folks. And I stood up and I said, okay, we're going to come up with the plan. Where do we start?
He put us in an auditorium, not even a meeting room. I thought I want to sit down with a meeting room with 10 people.
Working meeting.
It is.
And as the meeting evolved, someone said, okay, first things first, who's going to come in and do what? And as you map the whole process, QE and Gus knew, that's us. And then their voice was heard. And everybody goes, okay, they got that. The transport people, how do we get the material that QE brings to the bottom to where you want it PIH? Someone else raised their hand. So during that 3 or 4 hours, we were to establish who owns what area. People heard from them. They understood. So when the project started, there was nobody stepping over each other. They go, QE, Gus's team, we've had a meeting, they have this. And then we left that meeting,
crazy.
He kind of mentioned it earlier, hey, Chico, I need to come back over there. Now that I know what part we own, I really want to go understand what part we own. I think all of that together really helped us kick off and that project and really helped everybody to understand who each other was. Because, I mean, we didn't really know each other.
Put a face to a number, right?
Yeah. And like you mentioned, we had our trusted. We hadn't even really signed everything just yet.
Wow.
But we got that meeting. I remember telling my team, and my team, really, they kind of were like, how are we going to do this, Chico? And I said, I'm going to go back to military time. How would we do it? We bring everybody in. We start the left. We're going to end right. And that's the only thing I know how to do. We did it again for COVID. I know that's a story for another time. That too. But those two approaches helped us get through this big project and through COVID. Just kind of bringing the people in. Everybody has a voice. Everybody has expertise. Letting them speak. Understanding and hearing it positively. And then coming to an agreement, and then from there...
You pick the best companies, you know, all the vendors, they're all diverse, they were diverse.
we had a woman-owned transportation company. So you saw in that room the beginnings and the manifestation of kind of what I believe, what the organization is supporting, and you saw it. And
definitely.
It was something to see.
That's pretty cool.
It's a big opportunity, and that's what we love, you know, these projects that are very challenging, where we can showcase our skills and abilities to do the work.
So Chico, what do you do supply chain within the hospital. So what do you do exactly? I'm curious. I know you manage a lot of people, and like you were saying in this meeting, your team was asking you, how are we going to do it? So a lot of people. So what exactly do you do within that supply chain?
Yeah, that's a great question. So healthcare in general is huge, right? There's doctors, there's nurses. I have environmental services, everything that's cleaned in the organization. That's part of supply chain. Everything that we order, it could be a Band-Aid to an MRI machine is managed by supply chain. Every procurement contract, and that's the big piece, right? When you look at my organization and the amount of money that we spend on procurement, a lot of that I'm responsible for how to decide who do we basically partner with, contract with. Some of it's through our GPO, our group purchasing organization. Some of it is independent, B2B, right? So that's a big part of my job. Is the organization relies on me that we're going to pick the right vendors. They're going to be compliant with all the healthcare regulations. And then we have internal governance. We have policies, right? And I'm happy to say it, and I'm hoping to bring this up. We now have a policy that every project over a certain dollar amount requires at least one diverse vendor to participate. So no longer am I able to, or anybody in the organization able to say, I'm going to bid this project for this, which bottles of water are going to sit on this table, and all three are not going to be diverse. By policy now, one of them has to be a diverse to compete with it.
And this policy is done by who exactly?
By the organization's board of directors.
So this is PIH.
This is PIH.
This is not like California
So
run.
what I'm hoping is it'll be an example for other healthcare organizations.
I see.
Because the government is already doing it. Contract with the government, you have to, if you don't come to the table with and then in the government, if you don't pick the diverse one,
you get in trouble.
Why? You get in trouble.
You get in trouble,
Utilities and insurance companies are getting close to that. Healthcare, I know it's a little different. So I said, okay, let's at least this gets them to the table, right? This says if you have a big project, how do you ensure that you? So that's my way. It's PIH's way to support. Get into the table. Now, from there, then let's go bid on this project. So it's a start. And
I like that.
And I'm not saying we're the only ones doing it, but I know it's not a common.
I don't think I've heard that
And I have shared this at the state level on the commission that I'm part of, and I'm hoping, this is my personal hope, that as people kind of hear, they go, you know what?
They'll inspire.
I just tried it. And that's why, we invite you to our diversity fair. I want people to hear
about
story,
everybody.
and then we're not just saying it, we're showing it. And then maybe someone goes, you know what? It doesn't hurt to try. I think what they're afraid of is if they create a policy like that they're going to be, that somehow they're not going to get the product they need.
Like quality work or quality product because it's a diverse.
That's not the case. You are going to be surprised because
that's true.
In most instances, the people who are doing the work are diverse anyway, especially in California. They're just not at the table because there are 2 or 3 layers between them and the person who's traditionally been at the table.
They're not the head honchos
and that's been the case for decades. Now we're starting to see, as they say, I use the term, the ceiling's breaking, right? Whatever you want to call it. It has broke, but for different diverse groups, right? It broke for women years ago.
Yeah, that's true.
And we see it. And then you have African Americans and you have Asians and now
it's only a matter of time.
Yeah, and now healthcare as an industry, it's a late adopter, not by intent, but just kind of just the way that the ceiling has broken across all industries. It was easier in other industries. So I'm glad we're part of the movement.
Yeah.
I think
it's going to continue to grow. And I just hope, the day I decide to retire and hang it up, I can look back and go, there's a couple of things I'm very proud of.
Yeah.
Especially at PIH, and I want to be able to say, gosh, this is one of them.
That's incredible.
Vendor representation.
And I love your background. When it came everything from your mom. And pass it on to you, and now you're helping the community, helping all these small business companies and family-owned business, to help.
When you got sworn in and a citizenship, I remember my mother's to the day.
Thank you.
And she was 40 years old, I think, when she went, and I remember practicing the Pledge of Allegiance with her. She did to make sure she had it perfect.
Wow.
And I remember going to her that day. So when I saw your story, right away, it brought me back.
It brought you back to the memories with your mom.
So I know how you felt. I know how your family felt. I know what it takes to even get to that point.
To get to that point. It was big for me.
And I wish that's what they would show more on television. Right?
Yes.
Yeah.
I get what we're showing on television. Why don't you report the numbers of how many people became Americans today?
Definitely.
That's pretty cool.
Tell their
I would
story.
like to know.
We don't hear enough of their story, but yet we're concerned with how many people who aren't Americans are trying to get to where my mother, right? All of us. Mm-hmm. So we'll get there. We have to democracy, and everybody has a vote, and I'm a believer that we'll eventually get there. But it's sometimes the conversation skewed to what people.
Yeah,
it's true.
They want to incite versus inspire.
And thank you for that acknowledgement. Yeah, I mean, it was for me. It's big. At the age of 50. Did the oath ceremony and with my family, Sam,
I was so proud.
My kids and my mom and my dad, to be able to be there with me. I mean, they definitely have a different feeling, and you were saying, hey, sometimes we take it for granted.
We do. I mean, I was born here, and sometimes I feel like you at such a young age started working and didn't go to high school, didn't go to college. And look at what you built. Like, I'm really proud of you, regardless if you were not a citizen, So,
everything started with my mom, my grandma, and my father. They laid the foundations. They helped me lay the foundations. Integrity, loyalty, honesty, and the most important, you always care about your family and the community. Do your best for the community.
Never forget where you came from. Never forget who came up with you.
Okay, we're going to go on a short break and get ready for a fun segment of the day. When we come back, we'll be doing Twisted Trivia with Chico and Gus. So get ready. We'll be right back.
All right.
Okay, we're back. It's time to play Twisted Trivia. Okay. So let me explain how it works. I will ask a series of questions, and each of you will use the whiteboards in front of you to write your answers.
So we're going to grab it?
Yep, go ahead and grab your whiteboard.
All right.
There's a twist, though. You will be answering for the other person, not for yourself.
Oh.
So Chico, you will be answering like if you were Gus. So pretend in your mind, pretend you're Gus, and you're going to write an answer. And then you're going to pretend you're Chico, like if you're Chico.
Okay.
So think about the answer of what Chico would answer.
Okay.
Okay? Are you guys ready?
Yeah.
Right.
Okay. Is the other person old school or new school in terms of music, style, personal interests, and can you explain why? Write a little big if you can, so the camera can see.
Oof. Is this a eraser?
No, but behind your marker is an eraser.
Oh.
Yeah, right there.
All right. So I have to.
You guys are gonna say it out loud too. And let me know when you're ready.
Okay, I think I had it.
All right, you guys ready?
Yeah.
Yes.
Okay, Chico, you go first. Is Gus old school or new school?
So he's both.
You can turn it.
So he's both. So he's old school. I'm assuming on music. And he's new school thinking and style. I really like his style, wardrobe, the style, the office. I know there's some influence from you guys too, and obviously his thinking is very new school and current. But I'm only because I want to know. Old school, I put music.
Okay, so let's find out.
I'm a Bee Gees guy. So
Okay.
I'm old school music. Everybody knows me, knows I love 70s disco.
Disco, okay.
Hootie the Blowfish for some folks. So that's why I put there.
Yeah, I know. I like the 80s, 90s, yeah.
So did he hit it spot on? What do you think?
You hit it. Yeah, you hit it. Yes.
What about
That
in
was a good
style,
one.
like the way you dress?
Style,
Is new school?
Old school.
No, new school.
New school, yes.
Yeah. Okay.
Look at my shoes.
I think you're. I think you're almost right. I think the thinking is a little old school. I think you're a little old
You're talking
soul.
to my daughter here, so she
Yeah.
kind of like,
And I think you're right, right?
Yeah.
Like you can see it at the base, the thinking, hey, be honest, be transparent.
Right. Yes.
Like you just mentioned, I left him messages all the time. Then my daughter sends an email, and he goes, "I'm coming," right? But then the new school thinking, right?
Right.
You're going to go see some old school thinkers, but you're going to go see them today. So.
that's true.
That's true. I guess it goes hand in hand.
Yeah.
All right. What about you? What do you think,
What
Chico
I have for
is?
music is old school, so I think I hit it in the nail right here.
Okay.
And because I know he's a man of value and principles,
Okay.
they never go out of style.
Yeah.
You know? I mean, of course, you dress, you're the new era too, you're always looking cool and modern, but I think he's more like an old school,
All right. What do you think, Chico?
Yeah, music definitely. Love the Bee Gees. Anything on the Saturday Night Live soundtrack. John Travolta, I love. And it definitely values, right?
Yes.
I'll be the last one to leave the table. I'll open the door for strangers to walk in, even the party behind us. That's more mom, right?
Yeah.
Just respect.
I like that.
And then the style. Some people say I wear too much baby blue. So if you follow me on LinkedIn or if you're at my office, whenever I wear a suit, everybody goes, "You only have blue suits." So every now and then, when I woke up this morning, I thought I'll wear the gray suit, but I said no. Blue's my confident color. So
Okay. I like that.
So I am a little. And it really just helps me.
Nice.
Confident and comfortable.
Yeah,
That's a really good color.
All about what you wear. Sometimes it's like you wear something that makes you feel good and confident. You're gonna wear that any day.
On my big presentation days, this is what I'm looking
Blue
for.
suit.
I didn't want to mess up today, so I had to bring my fashion gear.
Yeah.
I'm most comfortable and confident. And so when I present, I'm the same way.
Yeah, and I knew that because yesterday I spoke with Samantha, and Sam says, "Okay, so what are you gonna bring tomorrow?" I said, "Well, I have a black blazer, I have a gray, and also a blue one. But I think because Chico's coming, I'm gonna wear my blue one. So I brought my
And that's
swag,
funny.
too.
Yeah, he told me he's like Chico's gonna wear blue for sure. So I'm gonna wear my blue one too, so we can match.
Hey, we have a great relationship.
And I chose not to wear a tie today because I felt like on the first podcast we did, I felt like that was part too tight. So I said,
Yes.
No, you look good. Yeah.
So that's why.
And typically I don't wear ties much because I have a big turtleneck. But anyway,
There you go. Okay.
So what else?
Next question.
Do we erase this
Yeah,
one?
go ahead and erase that.
Okay.
If you can live anywhere in the world, where would it be and why? And remember, you're answering for the other person, where you think they would want to live.
Okay.
Okay. This time we're gonna have Gus go first.
Wow, you put me in the spot.
Yeah.
Okay, I think it's Hawaii.
Okay.
I don't know why, but I kind of give me the feeling of the beach and the ocean. And, because you have the beach, it's a lot of freedom. Freedom meaning, with the family, you can go to the beach and enjoy, this cliffs and the forest and the jungle. And as part of you, I put like a question mark, maybe it's part of you. I don't know if you've been, probably been in Hawaii. And it's fun every day.
That's exactly perfect answer. We've been to Hawaii as a family a couple times. We love the Caribbean though. Everything you put on there.
Beach and chill, freedom.
Yeah.
Okay.
So that's our number one. We like beach vacations, cruises.
Nice.
And when the kids are out of the house in college and married, I plan to retire somewhere Hawaii-like, and so, yeah.
Cool.
Spot on.
All right. What about you, Chico?
So I'm probably not right, but I wanted only because I wanted to see. I put New York City, and so I'll explain.
Okay.
Similar to LA.
Okay.
But big new challenge if you decide to do work or personal, because you came up Los Angeles, huge as we know.
Yeah.
And I think, gosh, what if Gus says, hey, if there's someplace else I could try this again, what would I do? And I think, gosh, New York, based on the company that you run, our backgrounds, I thought, gosh, and then didn't know if you had ever been to New York. I know a lot of the big speakers that you follow. New York is a center for a lot of that.
Have you been to New York?
You know what? I've never been in New York, but I always have it in my mind. Yeah. Like I want to go and visit the Big Apple and all those cool places.
Would you live there though? For the rest of your life?
But this is the thing, like he says, I'm an entrepreneur and an immigrant too, and I love to go to different places where I can experiment. It's just like when I started in a payment.
Yeah.
Okay, I started residential and maybe industrial and commercial. Then, I want to innovate and diversify and go to the healthcare facilities and go into the school districts and government projects. So I'm a risk taker, and I like that. New York, it's similar to a city. I mean, it's like a center and a very city. I will probably retire by the beach because I love the ocean.
But you would try New York.
I would try New York.
Okay.
Yeah.
Cool.
I like the challenge.
I like it. Okay, next question. Oh my God, there's many questions, but okay, next question. If you were stranded on a deserted island and can only have 3 items, what are they and why?
3 items, meaning tools or what?
Just any 3 items.
Any 3 items.
And only 3 items.
Okay, any 3 items. Okay, I will say.
So you're answering what you think Chico would bring. All right, Chico, you go first for this one.
Okay, so I like these questions. They make you really think. So I know he's a reader. He loves inspirational people. So his favorite, if he was stranded on a desert island, he probably want to bring his favorite book. If there was electricity, radio, because I think no one wants to be fully isolated.
Right.
And only because what you said last time about wanting to be by the beach, a comfy hammock.
All right. So he's going to basically be stuck in an island and be comfy.
And food and all that's taken care of. I got something that I want to read, someone I want to hear, and can I do it comfortable?
Okay.
Yes.
Oh,
you know what?
Right.
You need to, all those 3 items. I mean, I was thinking about that and similar things, but those are 3 I will definitely take it with me to the island.
All right, let's see. What would you?
I mean, maybe my answer is babe, but number 1 for you always being the family. So I just you will take the family. I was asking if it's a tool or
a family photo.
Yeah.
For you.
So family probably if it's not the family picture.
Yeah.
So always think about them. Food. You need food to survive in the island, and then you need a boat to escape.
Oh, the
boat!
boat!
If I have my family far away from me, I'm gonna take the boat and
Right.
Yes.
I said 3 items, and you really went above and beyond.
I tried.
Okay, next question. Who is your celebrity doppelganger, or what celebrity do you most resemble?
Wow.
So you gotta think Chico, and you gotta think Gus.
I'm not too good with the movies, but.
Or just like, who do you think Chico looks like as a celebrity? Like, what celebrity do you think he looks like?
Celebrity.
Yeah.
Rampage? No, I'm just joking. No. Where's the guy? I want to remember the one.
Where's he from?
He's American. Man.
Okay.
Call it a lifeline for your daughter.
Okay, I'll write some.
She says she has an idea. So
okay, all right. Okay.
All right.
Let's see what she says.
Okay. All right, let's see if we can. Hey, anything is possible on a podcast, right?
Yeah.
Especially I have my daughter right here.
That's
Chico's gonna laugh at this one.
What is he? Oh.
All right.
Oh, yeah.
All right, ready? And who's gonna go first?
I'll go first.
Okay, ready?
Okay. The Rock. Yeah.
Because you're tall and
And strong, and
right. Yeah.
No, that's my wife's. You know how everybody gets a crush. So, and you get the pass. That's her pass.
That's her. Oh my God.
So she'll be glad that you said that.
That's funny.
Yeah.
My pass is Mariah Carey. So I'm just throwing it out there.
Okay.
But
Mariah Carey.
That's
The
her
Rock.
pass, so
All right. We
Good
hit
job,
it.
Sam.
We
Good
hit
job,
it.
guys.
So mine is a combo between Vin Diesel's look and Kevin Costner's personality.
Oh.
I don't know who Kevin Costner is.
Kevin Costner, remember the Bodyguard
Waterworld?
movie?
Waterworld?
No.
Whitney Houston? Oh, you are young. What's that?
The Waterworld,
What's
right?
the Western series everybody's watching now? Yellowstone? Is it called Yellowstone?
Yellowstone.
Yeah,
He's the main guy.
I don't.
Okay, if you Google Kevin Costner, his personality
Okay.
and the characters he's played
With Vin Diesel's face.
Diesel's look. I don't like Vin Diesel's personality.
Yeah.
No, that's why you
look.
put
And
that.
this is your signature look, so I want you to
Yeah.
keep it. But Kevin Costner's personality.
Okay.
You know what's crazy is like for him, it's actually
Pitbull.
Pitbull.
Oh yeah.
Because of his glasses, like
People call me Mr. 562. So, anytime, guys.
If you wore dark glasses, I think a lot of people would say.
Yeah.
Yeah.
Mr. Worldwide.
Yeah.
But Vin Diesel, good. Kevin Costner.
Yeah. No, I mean, I need
You
to
don't
look
know
him
him,
up.
right?
All right. Well, thank you for playing Twisted Trivia.
Great game.
We'll be
Yes.
going on a short break, and then when we get back, we'll dive in to the next topics. So get ready. We'll be right back. Okay, we're back. Okay, so I had a question going back to I was reading up on you, and I saw that you're a black belt.
Yeah, so it's a little play on words.
Okay.
So I'm a Lean Six Sigma black belt. So
Okay.
it goes back to Toyota, Motorola. It's a process improvement methodology.
Okay.
It started in Japan, and when American businessmen said, "Gosh, Toyota, how do you make cars that last forever at low cost?"
Yeah.
It's a way called lean manufacturing. So
Oh,
you
okay.
take away unneeded steps. So
Yeah.
I'm trained in that as a black belt. So it starts off with white belt, yellow, green,
Damn.
black. And I'm actually a master black belt, which means I can train and certify lean. So
Wow.
it's heavy statistical analysis, heavy process improvement. In fact, at PIH Health, we're using it to solve big company problems. And it's been around for decades, but in healthcare, it's probably not as advanced as it was like where I came from PepsiCo, where I spent the last 15 years, I was doing full-time Lean Six Sigma.
And that was my next question is, okay, how did working in supply chain at PepsiCo translate into healthcare? So you learned a lot, obviously.
Yeah,
you were there for a long time.
For me, healthcare, PepsiCo taught me what I call big box logistics, right? You're talking thousands, tens of thousands of bags of products,
Right.
Assembly lines, manufacturing lines. And then what that prepared me for is the dollars are the same, but when you come to healthcare, you're really focused on, you do have a lot of boxes, but you really focus on the quality of that Band-Aid, the quality of that syringe.
Right.
Right. Not that PepsiCo didn't care about quality, it's just different because everything in healthcare touches the patient.
That's right.
Oh, yeah.
Even though everything in PepsiCo, it's called consumer packaged goods,
Right.
someone's consuming
Then it gets thrown away.
but it's not as life supporting or life saving as everything that we procure in healthcare. So
That's
PepsiCo definitely prepared me for the business of supply chain. I think what PIH needed and why they brought me to the organization, they were at the point where they were traditional healthcare supply chain, and they go, how do we get to the next level? How do we do what the big companies are doing? And that's 8 years ago when they brought me in. And so a lot of the time I've spent the last 7-8 years is really transforming PIH's health supply chain into a world-class supply chain that looks and talks and acts like every other company.
Right. And I did see also that during COVID, you did something, I don't want to say much, but you did in the pandemic, you made sure that there was enough supply of PPE. So can you talk about that a little bit?
Yeah. So, the biggest obstacle that most people woke up on was we can't get the stuff we normally get. And a lot of organizations in the healthcare industry were at the mercy of their normal distributors.
Right.
I took a cue from back in my military time, when I was telling Gus this earlier as we were prepping for this, when I was sent overseas with nothing more than a briefcase full of cash, and I had to find vendors and build an infrastructure that could support a Marine unit. So I sat my team down at the beginning of COVID, and I said, there's only two options here. We're either going to fail or we're going to succeed. There's no in between. Wow. The definition of succeed means we always have what they need, regardless of what it takes to get it. We fail if on one day, one person doesn't have what they need.
Yeah.
So we're quite proud of the fact that through the entire COVID pandemic, the high water mark when we had 600 COVID positive patients in our hospitals, in one of our hospitals, every time an employee, patient needed to grab a piece of PPE, they had the appropriate level and amount of PPE needed.
That's crazy.
The entire pandemic. That took a lot of hours, a lot of negotiation. We had to think outside the box, think differently.
Yeah.
But we're very proud that to this day we can say that our employees, our patients, our community had what they needed. Not everybody can say that, and it's unfortunate. We had people in our organization that worked at other organizations, doctors who had spouses and they would send me emails. I know it's different here because my wife comes home and she has to reuse a mask. I come home and she goes, you get a new mask tomorrow. I know it's you and your team, and I want to thank you.
That's pretty cool.
Sometimes that's the only email I'll receive from a doctor over 8 years, but I know that's the one he or she wanted to send. So we're quite proud of it. It took a team effort. It took, it's kind of ironic we're talking about diverse vendor partnership.
Yeah.
A lot of the vendors we went to were those small, diverse vendors who were nimble, who could provide 10% of what we needed.
Right.
Versus the big boy vendors who says
they couldn't do mass.
If we can't get you 100%, we can't get you anything.
Oh.
Wow.
So a lot of our vendors, and you met one of them.
They grew.
A lot of our vendors were small, diverse vendors that this pandemic was designed for them to come in and save the day.
Wow.
That's crazy.
Great story.
That's a great story. Thank you. I was just very curious, and I wanted to know.
Like you said, think outside the box. We live in a box. We eat in the box. We sleep in a box.
Yeah.
I always tell people, COVID was supply chain's Y2K. Many people didn't know what supply chain truly was,
right?
Or even what they did.
Yeah.
COVID put us on the map like Y2K put IT.
That's true.
Yeah.
That's true. Very true.
Very true.
Right.
And then one last question, but I'm going to have Gus ask about the Lucas building.
Yeah. So, we're done with emptied the Lucas building for, I don't know, dozens of trucks and dumpsters. We get all the stuff out. So what's a new plan? I mean, it's going to be demolished, it's going to be renovated?
Yeah, I will tell you, as it stands today, it's ongoing discussions, right?
Yeah.
There hasn't been a definitive decision on whether they're going to tear it down, keep it up. As we know today, it's up.
Yes.
It's partially occupied, right?
Nice.
All the items you removed are still removed. So we're just waiting for and I know there's a lot that comes into that discussion, right?
Yes.
The history of the building. Do they want to repurpose it? Is it the full building? But what I'm happy to say is that they do come calling and say, hey, supply chain Chico, we now have a decision, and if it involves your area of expertise, we know who to call, right? So
thank you. Yeah.
We definitely feel good about that we have a plan for whatever scenario they present us with. But as of today, they haven't made a definitive decision.
Well, we're looking forward, and especially being a historical building, and we being in the same building, we were there for close to 3 months. We're very familiar, and we would love to be part of that project and help you. And assist you.
And hopefully you feel this way. I would hate if you woke up one day and you guys are driving downtown and you're like, where's the Lucas building? Donna should be calling me going, where's the Lucas building?
That's a different podcast. That's a separate podcast.
So know that you won't wake up one morning and say, where's the Lucas
Where is
building?
it?
As long as it's still there, we're
Well, besides that Lucas building, I mean, you guys always keep us busy with projects you got all over.
In fact, I just talked to David Spare on my way over here. He wanted me to make sure he said hello.
Thank you.
And so, David owns a part of the business that your services support, and so we're great partners, him and I, internally at PIH Health, and so and we know, we definitely know everything that your company represents and has done for us. But
awesome,
you will be the call we make if that decision says, hey, this building
is coming
down, and there's some abatement criteria. You're definitely going to be involved.
Thank you.
Appreciate it. Also, if it gets renovated, you know who to call.
Yeah, definitely, because with that
environment,
there's regulations around before you put people back in there. But
right.
Sure. No, I want to say thank you, man.
Yeah, thank you so much, Chico. Thank you for being here. We're really grateful for that. It was a great time. We had a good time. Well, there you have it, Insider with Chico Manning. We hope you enjoyed today's podcast. Make sure to follow Quality Environmental on social media accounts and tune in for the next podcast. Thank you for listening, and we'll see you next time.
Yeah, see you next time. Stay tuned.
Stay tuned.